Well, greetings everyone, and welcome back to Aronowitzland. Wanted to do maybe a little more entertaining reaction video to a YouTube video I just watched randomly the other day. This is a couple of supposedly doctors who were trying to take a living creature out of somebody's ear. And I just wanted to go through this with you and maybe debunk it a little bit and have a little fun with it, and maybe learn a little something on the side. So hope you enjoy this reaction video. So one thing you notice right away here is that the two people are trying to handle this little tail that's going, and it doesn't seem like whatever creature is attached to the tail would fit inside of somebody's external auditory canal. I mean, basically, a cockroach of a moderate size doesn't fit into your external auditory canal. Small bugs do, and it's relatively common to have small bugs crawl into someone's ear when they're in tropical climates, especially because the ear is dark and warm, and so the insect will be attracted. But it's this kind of a creature that looks like some type of reptile. I think it's highly unlikely that whatever animal is connected to that tail is so small it could fit completely inside somebody's ear canal. Now, the next thing we notice is that these fellows, they're using little sharp, fine tweezers or pickups. The steel looks kind of grayish and doesn't really look medical grade, and that's one thing that tells me right away this is probably not in an ENT office or a emergency room where you typically handle this kind of problem. Now you notice that this tail is moving pretty rapidly, and they can never seem to get a hold of it. And it takes them a long time to solidly get a hold of it. And one wonders whether they're actually trying that hard to get a hold of it. You should know that they are being judicious in the sense that they don't pull the animal apart. I watched another one of these videos that I'm sure wasn't real. It was supposedly the head of a snake coming out, a little tiny snake coming out of somebody's ear. And number one, there's no way that the snake would get in tail first, and the snake couldn't crawl from one side to the other and the head come out the other side. But the people trying to pull it out basically tore the snake apart. You don't want to kill the creature in trying to pull it out and fragment it and then be left with a partial biologic foreign body. We should understand that a foreign body that's inorganic, like a stone, let's say, or a piece of glass, is in a whole other category than something that is originally organic. In other words, it's biologic. It was a plant, or it was part of an animal, that sort of thing, because those living things, even when they're dead, the outside of the cells contain a fuzzy protein. These are the HLA proteins, for example, in humans, that identify those cells as that specific individual. And that's how your body knows to attack those things on an immune basis. If it's a foreign body that's just chemically inert, like a piece of glass, let's say, the body just forms fibrous tissue around it, and you don't have a robust immune response unless that foreign body provides a nidus for infection. So inorganic foreign bodies, those are well tolerated and really depend on the physical and chemical characteristics of that foreign body more than anything, whereas biologic foreign body or organic foreign body, somebody else's tissue, a plant's tissue, that sort of thing, even when it's dead, will elicit a robust immune response and will continue to until that foreign body is somehow expelled from the body or walled off in a sequestered area. Okay, so you can see at the end, the video just kind of peters out, and we don't get any satisfaction of seeing the entire critter there. We don't see any relief on the face of the individual who's got something stuck in their ear, and it just kind of ends. So not really satisfying ending there, but it is entertaining to watch the little tail flop around. But you should understand, for the reasons I've given, that this is a bogus video, I believe, and it's highly unlikely that anybody would possibly get such a large critter in their ear on their own account. So let's talk, though, about how medically to deal with a living foreign body in the external auditory canal. So this is the external auditory canal. This is the pinna of the ear, or the external ear. There's a lot of cool little parts to it: the lobule, the helix, the antihelical fold, the conchal bowl, the tragus here. The embryology of the ear is very interesting because the branchial clefts of an embryo will fold in on themselves, and we have little grooves and hillocks that, through a very complicated pattern of folding, resorption, and growth of cells, becomes this beautiful external ear. And the other one interesting fact about the ear I'll point out from a biologic standpoint is when you see a little bump on the outer part of the ear here, and some people will have a bigger bump and even a pointiness, that's called Darwin's tubercle. And it represents the atavistic remnant, that is the remnant of an ear that is tall and skinny, like let's say a dog's ear or a rabbit's ear. And then our ear flattens out and becomes rounded as it grows, but we're left with this little tiny hint of what could have been. And I think I've got one here somewhere. If you look carefully, you can see a little bump there. So that's called Darwin's tubercle, as a reminder of our atavistic past embryologically. Now let's talk about the treatment of living creatures in the external auditory canal. So let's say someone presents to you as a medical provider, or you're a mom or a dad, and a small child has a bug in their ear, and they can feel it crawling around, and everybody's going nuts, and it's a terribly unpleasant sensation. It's very scary, and you know what to do. So let's say you're out in the woods, and someone wakes up in the middle of the night. Your 8-year-old wakes up in the middle of the night and has a bug in their ear. And it's obvious what it is, because there's nothing else that feels like a bug in your ear crawling around than a bug in your ear. So the first thing you want to do is you want to always have a little mineral oil. Mineral oil is great for a lot of different things. It's good for constipation, and it's good for this problem. So basically, all you need to do is first kill this insect. And the way you kill it is by pouring mineral oil into the ear. That mineral oil will engulf the insect, and insects breathe through little tracheoles in their skin. Because they're so small, they don't have a trachea like we do and a whole respiratory system. They breathe directly through their skin, through their exoskeleton that's made of chitin, little tiny tubes connected to the outside, and they go directly into the body of that insect and provide oxygen directly to the cells that way through diffusion, without a need for insect to actually inhale, exhale. It doesn't really have lungs or gills or anything. What we do is engulf that insect with oil, and it will go around those little tracheoles, those little tubules, and block them, and within minutes that insect will be dead. Now, once the insect is dead, and the way you do that is basically by putting that child, that individual, on their side, put the head over, pour the oil in, and just keep it there so it doesn't run out right away. And within a very short period of time, 1 minute, 2 minutes, 3 minutes, the insect will stop moving and give that person immediate relief. Then you can find a tweezer somewhere, make a tweezer out of a little piece of metal, a paper clip or something like that if you have to. And you can retrieve that insect intact from the ear. And even if you turn the head to the side and let the oil pour out. The insect will probably pour out intact with the oil. What you don't want to do is be too aggressive or rough and fragment the insect, and then you don't know if you got the insect out, and if you use a Q-tip, you may actually pack it further in the way you would, the way an old cannon works, and you put the gunpowder and you put the shell in and you pack it with a ramrod. You don't want to use a Q-tip in that way. You want to be able to draw that little insect out intact and look at it and see, okay, I've got all the legs and I've got both of the wings, or forewings if it's that kind of an insect, but you want to make sure you've got all the parts. Then you can use a little gauze or Kleenex, something that absorbs the oil out of the ear, and Bob's your uncle, you're done, and everybody can go back to bed. So I hope you enjoyed that little bit of information in that reaction video, and hope you didn't find that too gross watching the tail flop back and forth. I thought it was kind of funny. More later from Aronowitzland. If you have any comments, questions, something you'd like me to address, leave it in the comments below. I'll try to get to it.